MDMA, marijuana, LSD, you might think that I'm talking about a rave, but I'm actually talking about the future of health. Psychedelics in the right setting and the right context may have the potential to revolutionize the world of individual and collective health. Historically, they've been used by indigenous communities in religious ceremonies and spiritual rituals and healing modalities for centuries. But today they're earning attention as an alternative medicine to help treat and improve overall well-being.
Psychedelics are a broad range of plants, fungi, and man-made substances that help to alter the mind state, the consciousness state.
The reason psychedelics are such powerful therapeutics is because they tend to address the root cause. A lot of people with PTSD were having to take 1 or 2 psychotropic medications every day to just mask the symptoms. And in that masking, sometimes they even kind of numb the patient's emotions overall. Psychedelics aren't aimed at the symptoms, so either in the journey or perhaps in that integration after the journey, people are very often able to drill down to the root cause or the limiting belief that came from a trauma or something else perhaps in their childhood, and they can work on the source of that post-traumatic stress instead of just chasing the symptoms day after day.
I've had some amazing experiences and intense experiences with psychedelics, particularly with ayahuasca. I did this work with a group of people in a ceremonial setting. It took me back to a space within my childhood where I had experienced some deep trauma. I was able to heal from this, and I didn't have to carry the weight of that trauma with me anymore.
Psychedelics can do amazing things to the mind, but they're safest and most effective under the watchful eye of a trusted professional guide. The first step is usually a consultation to ensure that you don't have any allergies or pre-existing conditions that might interfere with the treatment. And this is also a really good opportunity to discuss your personal background and any goals or concerns that you have around psychedelic therapy.
I strongly believe that psychedelics are powerful tools and not to be done and taken lightly. Do your research. Understand what psychedelics might be right for you. Be sure that you understand the environment around you can greatly affect your experience as well.
Of course, psychedelics do have some risk. And the biggest risk involves the fact that these are very intense experiences. It requires a trained psychedelic facilitator or guide to know when somebody's just having a difficult journey or when somebody may be getting closer to something that looks like psychosis. And those are the things we try to prevent. There are harm reduction techniques, there are therapeutic techniques. There can be journeys that maybe aren't that pleasant. We think of those as challenging journeys because even if they're not pleasant, generally they have some kind of message for us and they're helping us work through something.
At the moment, not everyone has access to psychedelic therapy. Treatment can be expensive and in some places illegal. Communities who are under-resourced or facing socioeconomic challenges don't have easy access to these therapies, but that's changing.
One thing that the psychedelic community is working diligently on is to make these medicines available to previously marginalized communities that have either had a very understandable distrust of the medical system or have been excluded from the medical system altogether because of a lack of means. So we're working to make sure that BIPOC communities are represented, LGBTQIA communities are represented. It's important to have representatives of those communities that are working as psychedelic therapists so that people can go and experience these medicines with people who have a shared experience. That's really crucial in that therapeutic alliance and helping foster that openness that leads to healing.
There are numerous studies happening now that show that stress is one of the #1 killers within the Black and brown communities. Studies are coming out in terms of MDMA and psilocybin that they reduce stress and that they can reduce the harms of stress, heart attack, heart disease, hypertension, diabetes. It should be our #1 priority to make sure that there are inroads, that there is funding, that there is education. I think there is a great potential for that to happen because of the nature of psychedelics being based in healing, being based in expanding consciousness.
Although psychedelics can have many potential benefits, they aren't for everyone. They can pose serious health and safety risk for some people who have certain conditions. It's important to speak with a therapist or a trained guide who can lead you towards trying psychedelics in the safest, most legal way possible.
As far as psychedelic medicines go, my wildest dream is that these become first-line therapies for a lot of conditions. And I also hope that The way that psychedelics is looking at inclusiveness and accessibility for all starts to catch on in the rest of the healthcare system.
As we move into the future, there is a growing ecosystem that is emerging within the psychedelic space. The business side of psychedelics, it's going to grow. I hope that as we move into the future, there'll continue to be bridges in between the larger infrastructural business side of psychedelics and those doing education and advocacy work, those doing community and grassroots work. To me, psychedelics, what's mind-blowing about them is how connected they reveal we are to each other and to this planet.